www.healthcmi.com. Acupuncture continuing education online today. A little something different. Normally, we report on the latest research. Our team of translators brings you the latest in acupuncture research from China and Taiwan, also Korea and Japan. Our local teams focus on research from the University of Maryland and Stanford, etc. Today, a little politics. New York governor excludes acupuncture for injured workers, published January 3rd, 2019. New York Governor Andrew Cuomo vetoed SB 6666, a workers' acupuncture treatment bill that passed both the state Senate and Assembly. The bill included provisions for implementing acupuncture in the state's workers' compensation system. The bill would have allowed licensed acupuncturists to provide acupuncture treatments to injured workers. Governor Cuomo has effectively denied injured workers the right to receive acupuncture treatment for pain and suffering due to industrial-related injuries. The stance is fundamentally in opposition to an individual's right to choose their own licensed medical practitioner, and it also blocks medical doctors from making referrals to licensed acupuncturists. Now, interestingly, Cuomo, a Democrat, rejected this bill, which was introduced by a Republican from Albany and was co-sponsored by a Democrat from the Bronx in the Assembly. So it was a bipartisan bill. In fact, the votes, if I scroll down to the New York State Assembly floor vote, 120 yay and only 23 nay. So this had overwhelming support. He vetoed it anyway. Now, out of that 23 that voted nay, only 2 of them were from his own party, the Democratic Party. So he basically moved over to a position that was, 1, in contrast to the wishes of his own political party, and 2, in contrast to the overwhelming wishes of the opposite party as well. So it's clear that he does not support access to healthcare vis-a-vis acupuncture services. This flies in the face of what was published in the Annals of Internal Medicine. The American College of Physicians, the ACP, notes that acupuncture is formally recommended for the treatment of back pain, and this is something that's very common for injured workers. So here he is saying, don't use it, and yet the American College of Physicians is saying, yes, use it. If you go to healthcmi.com, click on news, and look at the article entitled New York Governor Excludes Acupuncture for Injured Workers, you'll see that quote there for the Annals of Internal Medicine and the American College of Physicians. So it is formally recommended in usual care biomedical settings to use acupuncture for low back pain. Now, citing quality evidence in modern research, the American College of Physicians notes that non-pharmacologic treatment with acupuncture for the treatment of low back pain is recommended, and the official grade by the ACP is a, quote, strong recommendation. Given the opioid crisis in New York and throughout the United States, the governor's decision blocks the use of an effective non-pharmacologic treatment modality, subverting an opportunity to provide pain relief alternatives. Now, Memorial Sloan Kettering Cancer Center in New York and University of York in the United Kingdom, researchers note, and I quote, "We have provided the most robust evidence for high-quality trials on acupuncture for chronic pain. The synthesis of high-quality IPT found that acupuncture was more effective than both usual care and sham acupuncture. Acupuncture is one of the more clinically effective physical therapies for osteoarthritis and is also cost-effective if only high-quality trials are analyzed." And that's the end of the quote. The cost-effective findings demonstrate that the governor's veto is fiscally irresponsible. In other words, why add another thing to the workers' compensation syndrome when you're only adding dollars and cents unless there's a cost savings? Well, acupuncture adds up. In other words, it works, it's safe, it's effective, gets the job done, and it does so in a cost-effective manner. Why veto it? New York has a long history, actually, of including acupuncture in integrative medicine settings. In fact, the first outpatient integrative medicine clinic was established at Beth Israel Hospital in New York in the year 2000. It's a teaching hospital, and the doctors created a postgraduate fellowship training program for licensed acupuncturists. The fellows worked 2 4-hour shifts per week for a period of 1 year, and this established an acupuncture outpatient safety record for the hospital. And there's a whole lot of New York history. when it comes to acupuncture. In fact, New York's acupuncture history includes its sports teams. For example, when pitcher A.J. Burnett was signing with the New York Yankees, general manager Brian Cashman sweetened the deal by promising to sign a team acupuncturist per Burnett's request. And the pitcher noted, "There's no doubt in my mind that I think it's helped. I found that I've responded really well to acupuncture." And that's the end of that quote, but that's not unusual. In fact, by the time the Yankees had signed on an acupuncturist as part of the team program, the New York Giants, I think, had over 20 years. That baseball team had an acupuncturist on board for over 20 years back in San Francisco. So a little behind the times there, but they're catching up. They've had that for many years now since, but things that work tend to catch on. And so we're a little surprised here in some ways that Governor Cuomo is kind of looking backwards to the days where people have no access to treatment and care, and that he's not really understanding cost effectiveness in medicine and kind of ignoring the opioid crisis as well. So we're not too happy with the results here, but there is pushback. Naturally, we haven't done any of that type of investigative reporting in terms of following the money and seeing where his campaign contributions come from. But given the overwhelming support in the Senate and Assembly by both parties, something's not right here. So that's our article for today. A little unusual. We usually stick to research and clinical medicine. Today, a little politics. We're unfortunately looking at someone kind of looking back in time towards if you can't pay for it out of pocket right away with cash, you can't get it type of attitude. I understand this attitude, but then again, if we're not going to give safe, effective, and cost-effective medicine to injured workers or anyone, then why do we have these insurance systems anyway to begin with? And we've had a problem across the board in the industry where people pay for insurances, many kinds of insurance, and have no access to care. So there have even been somewhat fraudulent insurance companies in terms of general insurance, wherein people pay premiums, and yet when they go to the doctor, the deductibles are so high they never really reach them, or they have a gatekeeper that won't get them to the care they need to get to. So if they request a specialist, they won't get it, or it won't be paid. There's so many problems in the system that need to be fixed. This is just a simple thing which would actually have a beneficial fiscal impact and, of course, a beneficial clinical impact. So it doesn't really make any sense in terms of helping the people. So we find that the New York governor is no friend to the injured worker here. I'm Adam White, licensed acupuncturist. Thank you for listening today, and bear with us as sometimes we do cover a little bit of politics. Hopefully, next time around, the New York governor will think differently and think of the people. www.healthcmi.com